What are the side effects of atorvastatins? The answer coming up.
Sunki.
Hi everybody, it's your pharmacist Sunki here. Today we are going to be talking about atorvastatin. Make sure you stay until the very end so you don't miss out on any important information. Everything I say today is of general nature only. It does not replace the need to see your local healthcare provider. Let me know down in the comments below what other topics you would like me to cover. If you haven't already subscribed to my channel, hit the subscribe button now and thumbs up. Without further ado, let's rock it. What is atorvastatin? Atorvastatin belongs to a group of medicines called HMG-CoA reductase inhibitors, also known as statins. It is most common known by its brand name Lipitor. What is it used for? Atorvastatin is used for lowering cholesterol in the body. Cholesterol is taken into the body through food and also made by the liver. It is needed for our body to make hormones, bile, and vitamin D. There are two major forms of cholesterol: LDL, low-density lipoprotein, also known as bad cholesterol, and HDL, high-density lipoproteins, also known as good cholesterol. Too much bad cholesterol can block our blood vessels and lead to heart attack or stroke. On the other hand, good cholesterol removes the bad cholesterol from the body. Atorvastatin works by reducing the amount of bad cholesterol made by the liver and raising the good cholesterol to reduce the risk of us getting a heart attack or a stroke. Before you start, things that you need to tell your doctor. If you're allergic to any statins that was previously prescribed to you, or if you're allergic to any ingredients listed on the leaflet, note that there are actually many different brands of atorvastatin in the market. Your pharmacist will be able to find a brand that does not contain the ingredient that you are allergic to. If you have any liver or kidney diseases or breathing problems. If you're pregnant, intend to get pregnant, or likely to be pregnant, as simvastatin can affect the baby in your tummy. If you are a woman of childbearing age and you are sexually active and you need to go on simvastatin, your doctor will usually give you a birth control pill to go with it. You need to let your doctor know if you're breastfeeding or intend to breastfeed. Atorvastatin can cross breast milk and affect your baby. Tell your doctor as well if you have pain, tenderness, or weaknesses of the muscle from other medicines used to treat high cholesterol and triglycerides. Any personal or family history of muscles disorder, or have any unexplained aches and pains in your muscles. Any low thyroid hormone levels, hypothyroidism. If you're drinking alcohol regularly, as that will increase the risk of you getting side effects if you're of any Asian descendant. I know the doctor should clearly see that you are Asian, but if you are a mixed child, it's harder for some doctor to pick it up, and the dosages of Asian background and a Caucasian is different. Now, this is a little bit of a gray area. If you have a type of stroke called hemorrhagic stroke or a type of stroke called a lacunar stroke, you need to tell your doctor that. If you have one of these strokes before, atorvastatin may increase the risk of having hemorrhagic strokes. However, this is a specialist field, so whether to use atorvastatin or not, it will be under the supervision and direction of a specialist. Medication interactions. Atorvastatin can interact with many other medications, so make sure your doctor and pharmacist know all the medications you are taking. This includes any herbal supplements, vitamins, and minerals that you buy without a prescription from the pharmacy, health food store, or supermarket. Now, if you're concerned that your doctor or pharmacist might miss any interaction, remind them to double check. Now, you can always bring a list of medications to your pharmacist, and your pharmacist will be able to help you work out if there's any interactions on the medication and let you know the severity of it and let you know what to do next. When your medication list exceeds a certain amount and it's hard for your doctor to keep track on all the interactions and side effects, your doctor will request for a specialist pharmacist to review all your medication and optimize the usage of your medication. If your doctor did not initiate that, you can always request your doctor to do so. What strength does it come in? Atorvastatin comes in 10, 20, 40, and 80 milligram. How to take it? The usual dose of atorvastatin is between 10 to 80 milligram and taken once a day at the same time every day. To get the best effect, swallow the tablet whole with a glass of water. Do not chew or crush the tablet. Now, if you forget to take it, if it is almost the time to take your next dose, skip the dose you missed and take your next dose when you are meant to. Otherwise, take it as soon as you remember, and then go back to taking the medicine as you would normally. Do not take double dose to make up for the dose that you missed. This may increase the chances of you experiencing side effects. If you have trouble remembering to take it, set an alarm clock on your phone so it rings at the same time every day to remind you to take it. Another technique is doing association reminder. Put a medication at the same spot where it's dry and at room temperature, say next to your breakfast bowl, so when you grab your breakfast first thing in the morning, you will see the medication and that will remind you to take it. Things to be aware of. Now be careful driving or operating machineries until you know how this medication affects you. Atorvastatin generally does not cause any problems with your ability to drive or operate machineries. However, it may cause dizziness in some people, so make sure you know how this medication affects you before you start driving or operate machineries. Now, avoid drinking large quantities of alcohol. Drinking large quantities of alcohol may increase your chances of liver problems when taking atorvastatin. Avoid drinking grapefruit juice. Grapefruit juice can increase your chances of getting side effects. Tell any other doctors, dentists, and pharmacists who are treating you that you are taking this medicine. Tell your doctor that you are taking this medicine if you plan to have any vaccinations or immunizations, especially a doctor that hasn't treated you before. If you are going to have surgery, tell your surgeon or anesthetist that you are taking this medicine. It may affect other medicines used during surgery. Side effects. All medicines, even herbal supplements, vitamins and minerals, things you can buy without a script in your pharmacy, health food store or supermarket, can have side effects. Sometimes the side effects are serious. Most of the time they're not. You may need medical attention if you get some of the side effects. Now, do not be alarmed by the following list of side effects. You may not even experience any of them. Tell your doctor or pharmacist if you notice any of the following and they worry you. Muscle and joint pain, muscle weaknesses, especially in the forearms, thighs, hips, shoulders, neck and back. Difficulty climbing stairs or standing up from a chair, difficulty lifting arms over the head, falling, and difficulty getting up from a fall. Constipation, diarrhea, stomach pain, nausea, feeling sick, heartburn, indigestion or wind, flatulence, urine infections, headache, stuffy or runny nose, nosebleeds, rash. Now, the above list includes some of the more common side effects of atorvastatin. They are usually mild and short-lived. Now, you must tell your doctor immediately if you notice any of the following side effects. Yellowing of the skin and eyes and dark-colored urine. It may be sign of some liver problems. Feeling weak and tired, significant increase in your need to urinate, significantly more hungry or thirsty than usual. There is a slight increase of risk of getting type 2 diabetes, and these are the symptoms of type 2 diabetes. Problems with breathing, including shortness of breath, persistent cough, and fever. Statins may induce diaphragmatic muscle weakness, causing hypercapnia and shortness of breath. Hypercapnia means carbon dioxide retention in your lungs. Now, the next lot of side effects that I'm talking about are the side effects that if you experienced any of these, you need to stop the medication and send yourself to the emergency department of the hospital immediately. Symptoms of allergic reactions. This includes cough, shortness of breath, wheezing, difficulty breathing, swelling of the face, lips, tongue, throat, and other parts of your body. You develop a rash, itching, hives on the skin, fainting or hay fever-like symptoms. If you experience any unexpected muscle pain, tenderness, or weakness not caused by exercise, particularly if you also feel unwell or have a fever. If you have brown, black colored urine, there's a condition called rhabdomyolysis, where breakdown of your muscles occur. This can lead to kidney failure and death. And these are the symptoms of rhabdomyolysis. Chest pains, sudden severe headache which may be accompanied by nausea, vomiting, loss of sensation, tingling in any parts of the body or ringing in the ears. Severe blisters and bleeding of the lips, eyes, mouth, nose, and genitals. Now, all these are serious side effects but they are very rare. More side effects information can be found on the leaflet of the medication. I will also put a link down below for you so you have access to them. Now, even then, the list of side effects there are not complete. New side effects can pop up. So if you experience any side effects that is not listed there, you can always report it to your country's medicine regulatory agency. In the US, it's called FDA MedWatch. In UK, it's called Yellow Card. And in Australia, it's TGA. Okay, enough of the side effects. Now, the last thing I want you to do is having all these side effects in your mind and being too scared to take the medication. I want to remind you, this is a life-saving medication. Most people don't experience any side effects, and if they do, they are the mild side effects and they're usually short-lived. Many of my patients are on this medication for a long time and they're totally fine. And it's this medication that is keeping them alive. So if you have been prescribed Atorvastatin, it means that the doctor deems that the benefit of the medication to keep you alive, preventing you from getting heart attack and stroke, outweighs the rare side effects that might not even happen to you. So listen to your doctor. If you are experiencing any side effects I mentioned to you, inform the doctor immediately and take it from there. Now, last note. It is great that we live in a world where we have all these life-saving medications in our fingertips. However, it is not a good thing for us to solely rely on these medications and not do any lifestyle modifications. This medication only controls the condition but does not cure the condition. Things you need to do besides following the doctor's instruction carefully to take your medication daily on time is to exercise, control your diet, reduce fat and salt intake, quit smoking if you are smoking. Now, these are very important to keep your body strong and healthy. Now, work with your local doctor and your pharmacist to achieve that. Now, I have also made a smoking cessation video. I'll put the link down below for you. In this channel, I've also made other medication and health-related videos to help keep your body strong and healthy. It is a growing library of medication and health information. Besides a pharmacist, I'm also a singer-songwriter, music producer, and an actress. If you're interested in finding out more about my other life, please check me out on my other playlist. I will be releasing a series of original piano pieces soon. I will put them all in my other playlist. Now, if you haven't already subscribed to my channel, hit the subscribe button now and thumbs up and follow me on Facebook and Instagram. My handle is @SunkiOfficial, and it's your pharmacist Sunki here with lots of love. See you around.